We are still on our bony pelvis, and we are going to talk about another aspect of the bony pelvis. We've already talked about the bones that form the bony pelvis, the ligaments and the joints that are of importance in obstetrics. Today we are going to talk about the divisions of the bony pelvis. What do I mean? We are going to talk about the part of the bony pelvis that really matters to us as obstetric nurses or midwives. So, for instance, we spoke about the ilium, the ischium, and then the pubic bones as part of the bones that form the innominate bones. But the fact is, whatever happens here cannot affect the outcome of your labor. The part of the pelvis that actually affects the outcome of your labor is from the sacral promontory downwards. So it means that every part above this sacral promontory does not have any implications for obstetrics or midwifery. And so for that matter, every part that is above this sacral promontory is referred to as the false pelvis. The part from the sacral promontory downwards is known as the true pelvis. So generally, in obstetrics, we will say that the pelvis is divided into false, the part above the sacral promontory, and then true, the part from the sacral promontory downwards. Good. So we'll focus on the true pelvis. The true pelvis also has divisions. So we have the brim, that is the mouth or the entrance is known as the brim. Then the cavity that is inside, and then the outlets where the baby comes out. So the brim is also known as the inlet, where when the baby is moving from the abdomen coming into the pelvis to go out, it comes here first, which is known as the brim or the inlet, and then enters into the cavity and then comes out of the outlet. So the divisions of the true pelvis are the brim, the cavity, and then the outlet. Good. So how do we know that these points are the brim, this is the cavity, and this is the outlet? So basically, remember the landmarks that we spoke about in the previous videos. There are certain landmarks that let's say you are drawing a circle or you are connecting those landmarks. When you connect them fully, you will say that you are in the pelvic brims. Now we will talk about the landmarks that form the pelvic brim, so pay attention. Remember the sacral promontory, that is the central point of the first sacral bone that projects inwards. It's like somebody has done like this. Yes, that is called the sacral promontory. It's the first landmark. Then you meet this winged out portion of the sacral bone. It is known as the ala of the sacrum. Then you meet the sacroiliac joint. Then you meet the iliopectineal line, the iliopectineal eminence, which is this point that is like a projected point here, the superior ramus, the inner border of the superior ramus, the inner border of the pubic bone. This is the body of the pubic bone. So the inner border, superior border of the pubic bone, the symphysis pubis. When you draw a line, when you draw a line connecting all these points from opposite side, because the landmarks that I've mentioned here, they can also be found here. So when you join all these points, you say that you are in the pelvic brim, or the pelvic inlet. Now just think about it. When the baby is coming from the abdomen or the uterus during labor and coming out, this is where it enters first before it drops into the cavity and then comes out. So the brim is also called the inlet. Now the second part, or most important, or the second division of the pelvis is the cavity. Now we also have landmarks that form the cavity. Good. We have the sacrum, the sacrum, the concave sacrum. So normal sacrum is supposed to be concave. So we have the concave sacrum. We have the sciatic notch. Remember this notch? Yes, the greater sciatic notch. Then we have the inner border, the posterior border. Remember this thing is called acetabulum. Now the posterior border here is also forming part of the cavity, and then we have the inner border of the symphysis pubis. You have this obturator foramen, the inner border or the posterior border. So normally we'll say that anything facing out is anterior and behind it is posterior. So you have the sacrum, the sciatic notch, the inner border of the acetabulum, or the posterior border of the acetabulum, the posterior part of the obturator foramen, and then the posterior part of the pubic bone. All these form the cavity. Now you come to the outlets. The outlets. Good. So we have the anatomic outlets and then the obstetric outlets. So with the obstetric outlet, we would say that it is formed by 4 main things. So we have the lower border of the symphysis pubis. Remember this cartilage. The lower border of the symphysis pubis. Then the ischial spine, the 2 ischial spines. And then you have the lower border of the sacrum. So for the obstetric outlet, that is the parts of the outlet that can affect the outcome of labor. We have the 2 ischial spines, the lower border of the sacrum, and then the lower border of the symphysis pubis, forming the obstetric outlet. Good. So for the divisions of the pelvis, we have the brim, the cavity, and then the outlet. Good. So the next time we continue this series, we will be talking about the measurements of the pelvic bones and what measurements are important to us as midwives or as obstetric nurses. All right. So please have a nice day. Subscribe, like, and then share to grow the time, to grow this channel. All right. Have a nice day.